Hi everyone, thanks for joining our channel today. I'm Dr. Chip Szymanski. Today's topic is how to simply assess sciatica or sciatic nerve pain. And along with that, we're also going to be discussing some of the ways that you can relieve sciatic nerve pain. So let's first walk you guys through on what is sciatic nerve pain. Now, typically when you go to a doctor's office and you tell a doctor, hey doc, I have pain radiating down my leg or shooting down my leg, or I have pain in my leg, or I have pain that's in my calf, everybody always assume that you have sciatica, okay? What I want you to remember is that just because you have leg pain and also maybe back pain in addition to the leg pain, it doesn't necessarily mean that you have sciatica. Now, the reason why for that is very, very simple. Sciatic nerve pain has a very specific quality of pain that literally radiates or shoots down your leg. Now, you might have pain in your leg, but if it's not radiating, shooting down your leg, or if it's not burning or tingling down your leg from the low back or from the buttocks down to your leg, to the knee and below the knee, it simply might not be as simple as that you have sciatica. It could be as simple as that you might have some hip pain referring to the calf. So some of the things that I want you to remember when considering if you have sciatic nerve pain or not is to consider the quality of the pain. Typically, the quality of the pain would be a radiating kind of pain, shooting kind of pain, burning pain that is in addition to the radiating down the leg or burning in the calf. Some people might feel numbness and tingling in their feet in addition to the leg pain that shoots down the leg too. But typically the pain is not going to be an aching or it's not going to be sore, and it can be sharp oftentimes because when you move a certain way, the pain can seem like a sharp pain because it is shooting or radiating down your leg. So again, it's very important to remember that quality of the pain really helps you to determine if the sciatica is a true sciatica that's radiating down the leg, or is it another leg pain that's coming from a different area, such as your hamstrings or your IT band, or might be just from coming down from the hip. So now let us move on to the next portion, which is how to assess if you have sciatic nerve pain or not. So let's talk about 3 simple ways that we can help you guys to assess if you have sciatica or sciatic nerve pain or not. So let's talk about the first one. The first one is actually through observation and the things that you would, of course, observe on your own. So one of the first things that we see when a patient comes in to see me when they have sciatic nerve pain is that they have the inability to sit, okay? Typically, sciatic is caused by nerve being pinched from a herniated disc. Okay, you can have a disc that is bulging, that is inflamed, putting pressure on the nerve, or you can have a disc that is herniating or protruding on the nerve, and then sometimes you can have an even more severe that the disc is actually extruding, which means that a portion of it is coming away from the main portion of the disc. Now it's sitting in the spinal or the central canal of your spine, and it's putting on the nerve roots or the spinal nerve roots or the spinal cord, which then causes pain down your leg. Okay. Now, typically that happens when those things occur, which is an irritation of nerve by a disc, right? It's because the patient is bending. Okay, so oftentimes the patient will not sit, because when you sit, you are actually putting pressure more on your disc when you sit than when you are standing. So oftentimes they'll stand out there in the waiting room filling out paperwork. No matter how much paperwork we have, they're gonna stand to fill out paperwork. Because when they sit, they know that they're not gonna be able to get up because the pain is so excruciating because of the disc pressure when they sit. And in the same factor, bending, of course, we increase pain too. So those are some of the three common things that you can observe on your own to see if you have sciatic nerve or not. So let's kind of walk you through why that is. Now, I have my spine, my trusty spine with me here. So when we discuss about disc, right, disc lesions typically occur because you're putting compression or load on the front of your spine. This is the front of your spine, this is the back of your spine here. So as you can see in the back of your spine, we have nerve root that comes out from what we call your IVF, or the holes where the nerve exit, right? The IVF stands for intervertebral foramen. So basically, the hole is where the nerve comes out from the spinal cord. So because this is the front side, as you can see, if I put my finger here, right, in where the disc is, and if you were to bend forward, guess what happened to my finger? You would be pinching my finger, right? So imagine what that's doing to the disc. So now, the most important thing to remember about your disc is that your disc is made of mostly very fibrousy tissue on the outside, very, very, very tough fibrousy tissue, but the inside is like a gel-like substance. So the inside is made to move based upon where the stress is. So if you are compressing the front portion of your disc, guess where the gel would go? It would actually go to the back, right? Squeezing the front, the gel would go to the back. So unfortunately, guess what's in the back? The yellow things here sticking out that we discussed, which are your spinal nerve roots. So if the disc is herniating, okay, or protruding from the pressure on the front side, which compresses it, guess where the disc is going to go to? It's going to bulge to the back, then that's how it puts pressure on the nerve. So hence, that's why standing, bending forward and bending causes more disc pressure. So oftentimes, patient would stand pretty upright to try to take pressure away from the low back, okay? Now when they sit, all the compression will put more pressure on the nerves, on the disc, which would then put more pressure on the nerves. And hence, also when you bend forward, of course, that's going to also put pressure on the disc, hence more nerve pressure on the sciatic nerve itself. So that's why patients oftentimes will stand to fill out paperwork when they are in pain. Now let's walk you through the second things that you can do to help to assess your sciatic nerve. This is what we call a Kemp's test. It is actually an orthopedic test that helps is to, again, put pressure on your disc. So what we have patients do is just simply cross their arm across the chest, and all they're going to do is just slightly bend forward, and they can go to the left or go to the right, and all that's going to do is put pressure more on the discs. And then it also specifically will help us, if you're bending forward, right, and you bend to the left side, it's going to compress more on the left side. It's going to hopefully, not always, but tell us that maybe the left side is more affected than the right side. Okay. Now sometimes you can have a disc that's sitting right in the middle, that's herniating in the middle, and it can cause left or right nerve pain. But typically it's going to be mostly one side or the other, causing right leg or left leg shooting down to the foot or down to the calf. The third one that we're going to walk you guys through is what I call a straight leg razor test. Okay. So it's not what I call it, but anyway, it's an orthopedic test that everybody does, from PT to chiropractors to medical doctors, orthopedic surgeon, that help is to determine if tractioning out that nerve is going to be putting more pressure where the disc is putting pressure on the spine. So we call it a straight leg razor, right? So this is how the test goes. You're going to be laying on your back, okay? And all you're going to do is literally raise your leg up, keeping the knee straight, and raise it up. And typically when you have nerve pain or sciatica caused by a disc lesion, as soon as the patient raises the leg up, the nerve tractions out more, puts more pressure, and guess what happens? They're going to have sharpshooting pain, or they're going to have back pain that increases. And guess what? They're not going to want to do that for very long. So, and typically the lower your leg is with pain when you're raising it up, the more severe the disc is, the more inflamed the nerve is, right? So if you can raise all the way up, just say past halfway before you have pain, then the disc might not be that bad. So those are the three very simple ways that you can access and trying to assess and see if you actually are having nerve pain that's being caused by a disc lesion, putting pressure on the nerve roots that is causing sciatic nerve pain radiating down your leg. Let's now walk everybody through the three really awesome exercises to relieve sciatic nerve pain. The first one I'm going to show you guys is how to do a Cobra Stretch. Okay. Now again, the Cobra Stretch is designed to actually emphasize the extension of the spine, okay, which is arching your spine like this. The reason for that is very, very simple. As we have discussed earlier, compression of your spine going forward makes it worse, right? Makes your disc worse. So when you are in the extension or arching your back, this direction, what you're doing is that you're taking the pressure off of the spine. okay? So that's how we are trying to relieve the disc pressure so that it's not putting pressure on the nerve itself, okay? So how do you do that? It's very simple. One, you can do this on the floor or on a table. You get on all four. And start out by staying on the ground here, head up, and you're gonna slowly push up and arch your back and extend your back this way, okay? And what I want you guys to do is to hold that for about 30 seconds, if you can. Some people, they're gonna have more spasm in the back, so they might only be able to do 10 seconds. The key thing is to keep progressing to 30 seconds, but no matter how long you can hold it, if you can only hold it for 10 seconds, you need to repeat 3 or 4 or 5 times, okay? And it doesn't hurt to do that during the course of the day too, not just at one time. So if you can do it 3 times a day, each time you want to do it about 3 or 4 times just to give the relief and take the pressure away from the discs. So the next exercise is bridging. Now bridging is a more aggressive way of trying to relieve sciatica, but it's actually very, very effective. Because what it does, again, it also decompresses your discs along with trying to stimulate or facilitate the back muscle to contract, trying to help you out more, right? To relieve a lot of the tension that you have in your spine during an episode or a flare-up of sciatic nerve pain. So bridging is, we're gonna have you do this on a table, okay, or on the ground, and pretty much all you're gonna do is keep your arms and your hand to the side, and you're gonna bridge upward this way with your hip and pelvis, and you're gonna hold that again for 10, 20, or 30 seconds, however long you can hold that, and you definitely want to repeat it 3 or 4 times, or even 5 times if you can, to take the pressure off your spine. Now, you can do it in reps by going up, hold it for 2 seconds, and go back down. I like you guys to hold it for 10, 20, or 30 seconds to, again, we want to relieve the disc pressure. So wouldn't it make sense to stay in that position longer? So the more you can stay in there, you're gonna relieve the pressure even more. Now, one caveat with that is that these lumbar spinal muscle oftentimes will spasm because of the disc lesion, right? So then it makes it somewhat difficult to stay in that position for prolonged periods, but if you can do it, it's gonna be much more beneficial for you. The next one is the Piriformis Stretch. This is actually one of my favorite stretch to relieve pain, particularly that is when it becomes so burdensome with regard to walking because of these sciatic nerve pain. It's going to help everybody to be on their feet and be a little more active, because sometimes when you have pain for that long, the first thing you want to do is just to be able to walk normally, right? And this will help you to walk somewhat normal for these short periods in a way until the nerve heal up more optimally. So this stretch here is, you can do on the ground. I'm going to show you guys how to do on the table here. So you're going to put your hands here. You're going to put your knees forward. So a lot of people, to show you guys how to do this stretch, they oftentimes want to just bring the leg up here. And again, it's hard when you have back pain, right? So we want to consider that you guys are in pain while you're doing this. So we're gonna walk you through step by step. So again, if you don't have any issue with that, then of course, if you're not as much in pain, then skip through it, But what I want you guys to do is, when you are in pain, to go step by step so that you're not throwing your spine out, okay? So you can keep your spine in alignment when you're doing this stretch. So put your hands down, get a good base. Okay, you're gonna put your knee forward this direction, and the first thing you want to do is just slowly turn off to the side here and brace yourself to the side. Okay, once you can feel the stretch here and you can tolerate it more, then you can slowly move this foot more this direction to put more stress on it. Okay, now if you can barely do this and slide to the side and put pressure on it, there's no reason to try to hike this foot up, trying to get more stretch out of it, right? So let's think about the consistency of it. The consistency is trying to get the stretch on that particular fibers of the muscle in the hip and the pelvis, okay? It's not how long you do it in this case here, it's just trying to access that as much as you can. If you can hold it for 10 seconds, you're like, oh my gosh, it's burning and aching so much, I have to stop, then that's fine, okay? But if you can do it for longer again, 30 seconds, go ahead and do it. Even if you can't get into the more of a advanced angle, even if you can stay here as long as you feel the stretch, that's all I really care about. Making sure that you feel that aching, throbbing stretch right in the glutes here, right in the back pocket here, with the muscle, which is your piriformis muscle mainly, but you're also going to feel some stretch on your gluteus medius and also your minimus too. Okay, so again, the key point to this is to remember to access those particular muscle and make it throb and make it uncomfortable for as long as you can, to help to relieve that particular muscle so you can put less pressure on the nerve. So thanks again for joining our channel. Please like and subscribe to our channel if you haven't. And of course, anytime you have any questions or any topics that you want us to discuss, please let me know. I love doing this stuff, so the more we can help you guys, the better it is. And of course, always remember, you only have one spine, so take care of it. And the more you take care of it, the more it's going to take care of you and keep you functional.